Okay, so next I'm going to present our speaker for the oral abstract number 4. And this is Dr. Jérôme van Causenbroeck, and he's from Ghent University. And as many of you know, the Ghent University has been one of the great leaders in vitiligo research for many, many years, and in everything from outcome measures to basic science research to clinical research. And if it wasn't for Ghent University, we would not have many of the discoveries that we use every day in our practice as well as in our research. And so Dr. Causenbroeck today is going to talk about prevalence and location of disease activity signs in vitiligo.
Hello everyone. First of all, thanks for having me here. My name is Jérôme van Causenbroeck and I'm a PhD student at the Dermatology Department of the Ghent University Hospital in Belgium, where I perform research under the guidance of Professor Van Geel and Professor Speekaert. I would like to tell you more about my research regarding prevalence and location of disease activity signs in vitiligo. So, several observational and prospective studies have described the relationship between different disease activity signs and disease activity. In the study of Rodriguez et al., a relationship between confetti-like depigmentations and rapidly progressive vitiligo was described. Other research had shown that patients with one or more disease activity signs had a worse prognosis and a quicker disease activity. The prevalence of at least one of these signs is high in the vitiligo patient population, where a prevalence of 47.3% was described, up to a prevalence of 61%. In 2020, a systematic review performed by our research group showed or provided evidence for a relationship between 3 clinical signs, namely Koebner phenomenon, hypochromic borders, and confetti-like depigmentations, and disease activity in vitiligo. This slide gives an overview of our research objectives. So we wanted to study the prevalence and the interrelationship between the different signs. We wanted to define the predilection sites of each individual clinical sign. And lastly, we wanted to calculate the sensitivity and specificity of these signs for determining disease activity. Our study was a retrospective observational research with a study population of 344 patients with non-segmental vitiligo. These patients were recruited during routine clinical practice and were scored with the Vitiligo Signs of Activity score based on clinical examination with a Woods lamp. Disease activity was determined based on a dynamic assessment, namely comparison of UV photographs of the present consultation and the last consultation. The detailed locations were recorded based on the UV photographs taken during the consultation. So this slide explains the Vitiligo Signs of Activity score. So where at your left side you can see the 3 different disease activity signs. So we do not only registrate the presence of the disease activity sign, but also the grade of presence per location. At the right side, you can see the standardized score sheet, where the presence of disease activity signs are registered on the 15 standard locations, resulting in a score and 3 subscores. In our study population of 344 patients with non-segmental vitiligo, we saw that 54.7% had one or more disease activity sign. The 3 different disease activity signs were approximately observed in 1/3 of our patients, so where hypochromic borders were most present. Here you can see an overview of the relatively presence of the different disease activity signs on the standard locations. You can see that confetti-like depigmentations in the blue boxes were mostly present on the arms, where Koebner phenomenon, the orange boxes, were mostly present on the hands, and lastly, the gray boxes, so the hypochromic borders, were mostly present on the trunk and the arms. In further slides, I will discuss the more detailed locations per disease activity sign. We will start with the confetti-like depigmentations. This diagram shows that we observed confetti-like depigmentations mostly on the hands, followed by the elbows and the ankles. So in 1/3 of the patients who had confetti-like depigmentations, they could be observed on the hands. This slide demonstrates the distribution of the Koebner phenomenon, where we can see that it was mostly observed on the hands and the knees. Lastly, the hypochromic boulders were more diffuse spread on the body, but are mostly present on the back and in the armpits. Further, we observed the interrelationship between the 3 different clinical disease activity signs. So all the statistical tests were strongly significant. So for example, in 64.7% of the patients who had confetti-like depigmentation, also hypochromic boulders could be observed. This table shows that it can be interesting to screen for other disease activity signs when another has been visualized. In this table, we selected all the patients who were scored on disease progression based on the dynamic assessment. So by comparison, the present UV photographs with UV photographs of the last consultation. The last consultation had to be within an interval of 4 to 14 months. So we could include 141 patients for this analysis. We saw an association between the different disease activity signs and disease progression. It has to be noted that these signs have a strong specificity, so if they are present, it is most likely to have an active disease, but they have a lower sensitivity. So absence of these clinical signs cannot rule out disease activity in the last 4 to 14 months. Also, a note has to be made. Due to the high interrelationship between the different signs, it would be interesting to study the sensitivity and specificity of every individual clinical sign when there is no other clinical sign present. Therefore, we need a larger study population to do reliable statistical tests. In conclusion, we saw that more than half of our patients had at least one disease activity sign, so it is frequently observed and corresponds to the prevalence showed in the study of Zheng et al., where a prevalence of 47.3% was noted. We have defined several predilection sites for the different disease activity signs, so I will repeat the most important ones. For confetti-like depigmentations, it were the hands, the elbows, and the ankles. For Koebner, it were the hands and the knees. And for hypochromic boulders, it were the armpits and the back. We have also noted a strong interrelationship between the different disease activity signs. The different signs have a high specificity, but a lower sensitivity, so the presence can strongly indicate a disease activity, but the absence cannot exclude disease activity. In general conclusion, we can say that these clinical signs have a considerable value, and the dermatologist can strongly consider to search with the Woods lamp for disease activity signs to assess disease activity. This was my presentation about disease activity signs. I thank you for your attention.
Thank you, Dr. Causenbroeck. That was an excellent presentation and very interesting. Before we get to the questions, I just want to make a comment that signs of activity is something that we as vitiligo specialists look for, but I am really amazed at how our colleagues who are in general dermatology know nothing about this. And yet you have shown that 50% of patients coming into your clinic have it. We showed 60% of patients coming into our clinic, and it definitely helped us determine our treatment plan. So what you are, your research and this information really needs to go out to the 50,000 dermatologists in the world so they understand this whole concept of activity. Also, I think the other thing your presentation confirms is that you can't just look at the face. You have to undress the patient and look at the axilla, the hands, the arms and legs, because these signs of activity are not going to be on the face in the majority of the patients. It's going to be elsewhere. So one of the questions, two questions, and I'll just put them over into one. Um, there's been some other signs of activity that have been mentioned in the literature and in discussions. And so did you look for inflammatory vitiligo, and did you look for pruritus or itching as signs of activity?
So for itching, we didn't look in our research. So we have based us at a systematic review of Van Giel et al. For inflammatory vitiligo, we have also registered the inflammatory signs, but in the moment they were too infrequent observed to have good and reliable results. So that is definitely something that we will do in the future when we have more patients included with inflammatory signs.
Yes. And I agree that inflammatory vitiligo, I did not believe in it until Dr. Harris, he mentioned it. I still was skeptical, and then I have seen about a dozen patients with inflammatory vitiligo. So I do believe in it, but it's very, very rare. All right. Well, I think those are the main questions that we have. And again, we will thank you for your presentation and wish you the best in getting more research done in this area.